Hello and welcome to our neurotoxin class. Today we will be covering the areas that may be injected using Botox, Xeomin, or Dysport, which all fall into the category of neurotoxins. On our model today we are going to demonstrate the areas that actually will be injected, and the areas that we are going to focus on are going to be the glabellar complex, the frontalis, and the periorbital crow's feet. So today, if we take a look at our model, basically if we have someone make the facial expression showing the glabellar complex when they frown. So we take a look here, what we see is the procerus, the muscle that's in the middle that's responsible for the 11s. As the patient is frowning, we also can take a look and see here you have corrugators, the two corrugators which are responsible for the eyebrows. You have a medial corrugator and a lateral corrugator. Those compose the glabellar complex, which we do inject with our neurotoxin in order to relax the muscle. When we have our patient go ahead and raise their forehead, then we are working on the frontalis. And this takes care of all the muscles and the muscular movement that creates lines and wrinkles in the forehead. As we raise our forehead, it focuses on these rhytids right through here. We are going to demonstrate on our live model where the areas of injection should be in order to get the most optimal aesthetic results. As for the crow's feet, when people smile, we can take a look here, the periorbital rhytids that are created by the orbicularis muscle and the areas that we are supposed to be injecting. We also have areas in the face that we can inject, and we can do an advanced neurotoxin class, which is going to include the gummy smile for those people that have an extra show of the gums and they actually would like to drop the upper lip. So sometimes when we have patients where their smile shows their gums at the regular smiling point, we actually have certain injection points in areas that we may inject in order to drop the upper lip. That's not something that's routinely done unless it's needed for the patient. Another area of focus for neurotoxins is also when someone puckers, we can see the mentalis muscle, which creates the dimpling of the chin, which is sometimes referred to as the peau d'orange. We also see the smoker's line, or smile lines, or straw lines that some people do not like, which creates these fine little vertical lines above the upper lip that we may also inject with the neurotoxins. So today, for our demonstration purposes, we are using neurotoxin called Xeomin. The other toxins that are on the market are Botox by Allergan and Dysport by Galderma. Xeomin is by Merz. So for Merz Aesthetics, for today's purposes, we're using Xeomin. This is 100 units, which is how the product comes in. I already have the product in my hand, which is a powder. What we're going to do is dilute it according to the manufacturer's recommendation, which is 2.25 cc's of saline. We take the cap off. We go ahead and have our saline. We insert our needle, and with the vacuum suction, we do not need to push on the plunger. It automatically draws the saline into the bottle. We do not have to shake or agitate the bottle. All we need to do is swirl it. As we're swirling, that mixes the product. According to the manufacturer's recommendation, we diluted the product down to 2.5 cc's of saline into the 100 units. So if we had a 50 unit vial, we would actually put in 1.25 cc's. In my 100 units here, I'm actually drawing up, after I've reconstituted the product, to half a cc. The 1 cc syringes are demarcated. I went ahead and drew it up with an 18 gauge needle. I now am going to attach to it my 30 gauge or 32 gauge, whichever you have available in your office. Every 0.1 cc demarcation on the syringe is equivalent to 4 units of the toxin. When you're using Xeomin or Botox, Dysport, it is different, and that's actually